Detroit has a phenomenal race every June. It's called the Detroit Grand Prix, which has Indy, it's got Indy Light, IMSA, so all the different car styles. They've got Trans Ams from here and there. So we run them on the streets of Detroit, downtown Detroit. It is spectacular. It is a must-see event every year. And you know, once I do something, I do it full-hearted. So I was like, look, if I'm going to help him out, I'm going to get traction.
Hey guys, we are back. Dr. Sinicropi here. I am privileged to be joined by Dr. Marc Moisi out of Flint, Michigan. Got some cool questions on Flint, you know, coming right up. But thanks for joining us today. Can you just tell our audience who you are, what you do? Why are you at the Society for Brain Mapping Conference?
Absolutely. Thanks for having me, and it's an honor and a privilege to meet you.
Please.
But I'm the director of neurosurgery and complex and minimally invasive spine at the Hurley Neurological Center in Flint, Michigan. Approximately 3-4 years ago, I was one of my colleagues reached out to me and said, hey, we really have a need here in northern Michigan at Hurley to develop a neurosciences center. There's a big lack in the community. Patients were traveling anywhere from 60 to 100 miles to get their care. And we want to keep our community right there, right at home. And we are the northernmost center in Michigan, or at least level 1 center in Michigan. So we get patients from all over. And now as we're continuing to build, not only do we build out to our community, we have patients from all over the state and country coming to visit us.
I mean, that's incredible. So first thing I say, when I visit you, when I come to visit your institute, to maybe do a podcast on site, because those are the best. I'm launching this entire, series, like going to all these different places. Is the water drinkable in Flint, Michigan?
Absolutely.
All right.
Absolutely.
How did that get fixed?
There's an amazing community over there, and they just went behind it. It was brought upon by one of the pediatricians who noticed it in the kids, and once you involve a pediatric community, all hands are on board. Let's get it fixed.
Well, I'm glad that that's fixed, because obviously there was issues like developmental issues and equity issues and all these other important things. And that community was the center. And you know what I felt bad for Flint? Again, not knowing anything, but I really felt bad that politicians were using it as a place to go get photo ops, but not doing, and that is really sad, and that just happens in our world today. Like, people go places, and it's just to get like whatever, or they want to get like an Instagram post so they can tell their constituents, oh, look what I'm doing, but they're not actually doing anything. It's just talking.
They just show up, and that's our biggest problem in healthcare, right? Isn't that our biggest problem in healthcare? It's not just one small community; it's our entire country. And this is where we need to move forward and collaborate, both as physicians and communities, to make it equitable for all our patients.
No, absolutely, and it's frustrating. So one of and I know that you're doing incredible things at your hospital system. We talked about how you're saving money and just getting down to the root, because if we don't do these things, we have to be economically sensible in order to be able to practice medicine and do these things. So that's fantastic. But one of the things that's frustrating, to me personally, is that, for example, I went with the Society for Brain Mapping, and we'd love for you to join us actually next year when we go to lobby down to DC. But policy is a big thing with the organization. But my frustration is, you go there, and you've got these politicians, and you have all their associates, right? Okay, whatever they call them down in DC. You have these people with their notebooks, and everyone's excited.
Yep.
Right, so we all had our little things. I talked about some like biohacking stuff, and we talked about a brain park and brain tumors and military medicine, all this stuff. Everyone had their own assignments to do. They talk such a big game. I can't tell you how many of those people took my number down and said, "That's amazing. I'm so excited about what you said." Zero.
Correct.
Zero phone call. Not zero.
I'm the same
right?
way,
Don't
both locally or nationally. And what's important is we all have to kind of push together, because without, us, the healthcare society. And the great thing about SBMT is this isn't a national society, this is a worldwide society.
Correct.
Right? So whatever problems we have here, they may have a solution in another country. So we're here surrounded by all our colleagues that will give us maybe different ideas on how to approach these, and vice versa. I was just approached by a physician out of Trinidad who's trying to build up a neurosurgical and spine program. And I'm like, look, I'm already doing this, granted not in Trinidad, but Flint is, a poor community.
Trinidad North?
Trinidad North. Without the good weather.
Yeah, Trinidad's it's a little bit. Listen, I'm in Minneapolis. I feel your pain. It's about the same.
Our feelings are frozen up there right now.
Yeah, there you go. My brother-in-law was actually he was actually stationed way up in the UP of Michigan. Mm-hmm. He's left now. Now he has a nice gig in a much nicer place. Not that it's not nice. It's beautiful up there, but unfortunately he was described. Imagine being on those choppy waters and it's ice cold and you're out there. He's a Coast Guard guy and it just
brilliant stuff.
It was for 3 years. It wasn't. I mean, I can tell you that seasonal affective disorder. You think it's bad
true.
In Minnesota? I mean, try the UP of Michigan. That's rough.
What's great is that Michigan's one of the few states that's north of Canada.
Yeah, exactly. Oh, yeah, that's exactly.
It's like we're sitting in Detroit. You know what? That's south of us. That's Canada.
Yeah, that's exactly.
It's warmer.
Yeah, exactly. But yeah, we feel your pain in Minnesota. I mean, as far as major cities, I mean, the big cities, Minneapolis is the coldest of the big cities. But a lot of the northern, cities in Minnesota are way colder than Minneapolis. So we'll just be thankful for what we do have. So as a neurosurgeon, you're very dynamic. Okay, so we were talking about like you're involved in like Indy car racing.
Yeah.
Tell us about that.
So I used to do a lot of event medicine when I was a fellow. Did a lot of the Live Nation concerts, and I was the doc in the box for a while because I love music, I love event medicine, and it was a way to kind of express myself in different ways. I met the director of motorsports, his name Dimitri, and we call him Dr. T. He's an ER physician, and he found out we do event medicine. He's like, hey, come out to the track. So Detroit has a phenomenal race every June. It's called the Detroit Grand Prix, which has Indy, it's got Indy Light, IMSA, so all the different car styles. They've got Trans Ams from here and there. So we run them on the streets of Detroit. Downtown Detroit, it is spectacular. It is a must-see event every year. And, once I do something, I do it full-heartedly. So I was like, look, if I'm going to help him out, I'm going to get track trained. So I went out to Indy and got my certification. That's and now awesome. Every year, and what's important is I talk to the drivers, I talk to the my other medical colleagues, and it's a fun way to make a big difference.
No, it's huge. And then you're out in the track. I mean, for those, I don't know a lot of people that are associated, but I do know, some people that are in that world, it's everything to them.
Oh, yeah.
Like people that get into that track, I'm not talking about doctors, I'm talking about either the racers or the people that run the race teams. Because I knew the guy that ran one of the race teams, like the 3M team up in Minnesota.
That's a phenomenal team.
They are like obsessed about that stuff. I just love people that just bring passion and joy, and they get so much joy out of it. That's just not my thing. I mean, that's not. Yeah. It might be. It might be
know.
if you take me down to the racetrack.
You
throw me in the racetrack. Next thing, it's my thing. Hey, let me ask you about the.
And I just got to throw you in the pits, and that's because once you get in the pits and you get into one of those fire suits, you're addicted.
That's it.
For life.
That's the addiction. No, it looks fantastic.
You think we're efficient as surgeons? Wait till you see that tire change.
It's
insane.
I mean, we
You're
watch
like
it on TV.
People.
That's insane. That's like absolutely
and
insane.
But
that's the speed you have to move as a surgeon when something goes wrong.
Yep.
But you have to do it in a Captain Sully checklist way, not
Correct.
like the roof is on fire. Let's just
Correct.
do random stuff. And I love to go on tangents on these things, but it's fun. That is one of the number one things that people have to be able to do. As surgeons, you're a neurosurgeon, you're dealing with some really intense stuff. You have to be able to self-regulate when things go wrong, and that's where like the car thing, because when something goes wrong there, it doesn't end up too well for anybody.
Absolutely.
And so when something happens with a patient on the table, it doesn't end up. So we do this, and actually we have a talk coming up here. I think it's on Sunday, where they're going to be talking about utilizing mixed reality to help people to learn how to self-regulate, even as they're doing their training and stuff like that. Because the truth is, learning some of the technical stuff, not that everybody's going to be great technically, right? But learning the technical stuff, you can teach somebody how to change a tire.
Absolutely.
Somebody could be part of that crew, but you can't teach them how to manage their emotions when everything is falling apart.
We had a great talk and seminar when I was a fellow. It was called Awake at the Wound. And it was given to us by a golf coach and one of my orthopedic mentors, David Hanscom, who's a big-time spine surgeon, just recently retired. The one formula, if you're going to take from anything, performance is skill minus interference.
Love it.
Right? In order for your performance to equal your skill, no matter how heavy of a situation it is, you got to minimize your interferences. And that's exactly what you're talking about. It's the mental health, the mental game, in order to be able to do it. You know, it's the way you think about it, you know. You remember your failures, but never your successes.
Of course.
Right?
That's a negative bias. I mean, that's the way
but
it is.
But that's the way we are.
That we're literally built like that. I think it's a survival. It's a survival.
But why
mechanism.
is that? Because that makes you sad, not happy. So you got to flip that around.
You do.
Right? Every time you hit a, you know, I'm not a golfer, but the way he taught us, every time you play golf, you remember all your bad shots into the forest. If I say don't hit a shot into the forest, what's the first thing you're going to do? You're going to hit it in the forest, right? Don't put a screw in the canal. What's the first thing you know? You know, so you got to think, you got to look at your successes. Because that's how you build yourself up. That's how you build your community up. That's how you build your team up.
No, 100%. But you have to be, but you know, one of the things that I've noticed, because we always talk about checklists and we talk about things that we need to do to keep our patients safe. And that's all fine and well until things deviate off the path. Sure. So maintaining a level of calm, of self-regulation, of tuning out the noise, because as you know, like for example, if a patient's on the table and they're crashing, there is so much noise in the room, and the truth is, I'm at a point I don't even hear, like I don't even know that it's happening.
You just hyper-focus.
But if you really listen, it's bedlam is going on in that room. People are coming in, there's blood, you know, coming in and out, and there's people, and the neuromonitor, oh my, and everyone's like, oh my God, you know, whatever, and obviously anesthesia. They get pretty anxious, but I've seen anesthesiologists who I know, like their normal personality, they're pretty hyper and they're all over the place, but when things go wrong, they like all of a sudden they're like Zen. They're like a monk, you know, like in the Himalayas, like just laser focus. Everything just disappears. Just zone in, and you do that.
And that's the most important part about having a good team. And I'll tell you, I actually ask all my team members before, like we all do a timeout. I ask them what their interferences are early on in the game. That way I know it's something not sterile. Is the patient about to crash? What are your exits methods, right? You need an exit strategy for everything you do in life, whether it's a surgery, whether it's walking down the street. You know, so you just need to understand that. Obviously, you don't do that for every single event, but for surgery, which is a main event for that particular individual,
main event,
100%.
Yeah, and having that, you know, again, everybody quotes this, so I try to like not do these like quotes that are overused, but Mike Tyson, right? Everybody has a plan until somebody punches you in the face. And that's what happened, and that's what you have to do. But when I teach like younger people or people are interested in medicine, the two things that I just kind of tell them: one, you really need to understand this is it's an emotional game. There's ups and downs because, and we actually, there's been a lot of talk of that amongst the surgeons. It's like, you can have 20 successes. If you just have one thing that goes wrong, it just plays that, and so you have to be able to like deal with that. But then, you know, like the other thing that you have to be able to really deal with, and I'm just curious on your thoughts on that, is you have to really understand that when you're a neurosurgeon, I'm an orthopedic spine surgeon, you know, our worlds cross enough, and most of my partners are neurosurgeons, as you know, but people have to know it's really 24/7.
Correct.
Like no matter what it is, even when and I've talked to so many people on podcasts before, just curious on how you deal with it. Even when we're on vacation or we're doing something, there's always a thought of a patient or something. There's never nothing going on. And no matter how far you get away and you know your partners are taking care of your patients, they're still with you.
Correct.
It's not like we're on the beach having and I never have even a fleeting thought. And for some people, it's not for everybody. So I just want people to be really careful about going down this road if they can't just say, I understand. It's just that. It's just what it is.
That's what's important, because you want your surgeon to be like that.
Of course.
Right? Every patient to me is a family member.
Of course.
And that's how you treat them, and that's how you try to optimize their care, right? And surgery, medicine in general, always has to be a calling. It shouldn't be necessarily
100%.
It's not a profession, it's not a job, it's a calling. And
100%.
you know, what's equally as important is having your family. Your family needs to be understanding of that. You know, but you know, you also want to incorporate your family into this. So my 7-year-old comes on rounds with me.
That's amazing.
She loves it. You know, one time for one of her school projects, I put her in the OR on a Saturday. I brought out the microscope. She got her little clay skull and just practiced, you know, and that's how they kind of understand that it really is a calling. It's a profession. Whether they follow in your footsteps or not, they have a better understanding of what you do, that yes, sometimes you do take away from them, but then you give twice as much back to your family.
100%. I love that. I used to take I've never taken my younger one on rounds, but I used to take my older one on rounds some when he was little. And it was, I mean, how much the patients love it. Oh my God. They see your kids, you know, rounding with you, you know, they're fired up. I think that's great. And I think that message really needs to go out, that it's a calling. And unfortunately, I'm seeing in medicine a lot of apathy, a lot of complacency, and it all comes from burnout.
Correct.
Because physicians are burned out. That's why it was such a pleasure meeting you on this conference, because you're as fired up and as excited about medicine as ever, and so am I. I can't be more excited. I want to learn everything now. I've gone way outside of my comfort zone.
Correct.
I just we just did one where people are sending their brains out into space, they're making little miniature, mind blowing kind of stuff. So going way outside of the comfort zone. So I think it's great, and that attitude. How do you deal? You're in a position where you're managing other physicians and other staff, and really trying to make your hospital the best hospital there is around. How do you manage this concept, this problem with burnout, both with physicians and with nursing? Because it is, I talk about it openly. I talk about my upcoming book, all this stuff. Burnout is a huge problem for us. And the more our colleagues get burnt out, the more the quality of medicine is going down. So what do you say?
I think, number one, the most important is collaboration. Yes, I'm building a center, but that doesn't mean I push out all other centers. I collaborate with all my local centers, all my local physicians. It's better to be more than less, right? I was lucky enough and fortunate enough that I got to hire my mentor and one of my good friends as partners. So I'm lucky in that. I just
and I'm sure
that. And it's not always true, and you got to learn to work with different personalities. But I think the most important thing, it kind of goes back to awake at the wound. You got to listen to your fellows, whether it's someone you even deal with 1 minute a week. You just got to listen to them. They'll tell you. If all else fails, listen to your colleagues.
100%.
Right? And they will tell you their interferences. What I always tell my OR colleagues, I don't want to be your interference, and I don't want you to be mine, because then our performance won't equal our skill, right?
I'm gonna steal that.
Please do.
I like that. I'm gonna do the interference timeout. I love that. I've never heard anyone say that. Before.
But it could be anything, right? It could be, but your interference could be, something happening at home too.
100%.
Right? Or it could be your tray's not sterile. But if you know ahead of time and you know how to adjust for it, it no longer becomes an interference.
Yeah. So and I think, but again, your attitude, the way you're approaching things, is awesome. It's a breath of fresh air. This problem where people are feeling like they're losing control. So physicians in our society, they really feel like the number one cause of burnout, it's not the electronic medical record, it's not all this other stuff that people try to say, it's 100% feeling their lack of autonomy. Look at what you've done.
Yeah.
You go to this thing, you're asked, come over here, we're having these issues, please help us. You go there, you just literally go all in, and you know what? You own it.
Yeah.
And when you own something, you feel really good about
Correct.
getting up every day and doing what you're doing, as opposed to going in, punching out the clock and being like, well, they tell me I can only have one assistant from this hour to this. You're not doing that. You're like, no, I'm going to try to make the rules and do it. We need to do that more as
100%.
physicians. You got
And
me
all
inspired
healthcare,
here.
it's all healthcare, right? Because I try to tell my staff, Monday should be your happiest day, not your saddest, and Friday should be your
Thank
saddest
God
day.
it's Monday,
Yeah.
right? That's
Because without that, because if you don't have that attitude, you're already starting at a low.
yeah.
You want to start at a high and end at a high.
Yeah, and that's what was the name of that movie? The one the somebody's got a case of the Mondays. We don't like that. We don't. It was with Jennifer Aniston
Yes,
was in
yes.
it, but anyway, it'll come up after the show.
We're dating ourselves.
Listen, we're doctors. We think about other things other than like every show. But I love analogies back. Is there anything crazy that you're doing right now? What's the craziest thing you're doing what's the craziest thought you have? Something that you really want to get involved in medicine that you think is maybe the next thing?
I think just like Dr. Haradas gave a wonderful speech, it's AI. That's the next generation. And I think that's going to push patient care, but it's also going to help us as physicians to become better versions of ourselves. Because there's going to be a checks and balance. There's going to be, hey, are you putting in the screws in the right person, or are you doing the right surgery?
100%.
And I think that's the next generation, and that's, the people that are afraid of that should be a little bit more honest with themselves.
Yeah, what are they afraid of? Listen, you're preaching to the choir. I know a lot about AI. I've been reading about it for a long time, and I've experimented with all the different things. There's a little bit, I'll be like the others, I have a little bit, of fear about what the potential is for AI, because the question is when you're talking to these AIs, and I've asked I asked the guy that wrote the book ChatGPT MD, who was actually on my podcast.
Yep.
I asked him this, it was one of my favorite questions ever on a podcast. I said, when I'm talking to the AI, who am I talking to? And you know what? I thought he was going to say, oh, it's just an algorithm, large language model. He's like, that's the question.
Yeah.
Who are you? Like, it was like, who are you talking to?
Because no one knows.
Because there's some sparks in there.
Yeah.
And they're getting more sparkier, let's just call it. And it's, but I do like that. I do think that it's going to give us checks. You know what I like about AI? What about AI is like, we have ways of like taking care of patients, and we're like really fixed in our mentality. We have one brain. That's billions of brains, trillions of brains. If I ask trillions of experts simultaneously at the same time, hey, should I be operating on this patient who has X, Y, and Z? Once we plug in all that data, I'm not saying they're ready now, but that is a great way. You're absolutely right. It's like, I don't necessarily have to call you at a surgery to ask my guy in Flint, hey, I have this case and I heard you talking about this very case. I can ask a trillion people and they'll give me an answer in about 2 seconds.
Correct.
And it'll be like, they'll spit out, blah, 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 do this, do this, do this, do this. And it doesn't mean I'm going to do it 100%, not yet, but it definitely gives me a blueprint instantly for a way I can help people. So I don't think they're going to replace us, but I think if we don't know how to use the kind of the all-seeing, mind, we're going to really fall behind, and we have to do it.
And I think the important thing about it is just like anything you use in medicine, a fool with a tool is still a fool.
A fool with a tool, man.
So you need to understand it, and it's the key to AI is utilizing it to make you smarter. And to your point,
Love it.
right? Your point is you're asking all your smartest friends the answer to the question, but you're still making a judicious decision on your own.
Yeah, it doesn't mean you have to. It doesn't mean you have to listen, but it kind of has access to everything, and I don't currently to have access to everything all at this, all at the same time. So I think it's great, and I think it really. I think for our colleagues that are watching this, I think that you need to get on the AI train.
100%.
And you need to understand what's coming. And I think that hiding in the closet, hoping to come out in 5 years and the world is the same as it is today, is a huge mistake.
I wouldn't even say 5 years.
No, I know.
1 to 2 years. I mean, look at the internet. It took like 10, 15 years to really, really take off. Who heard about ChatGPT 2 years ago? Right? 2 years. Yeah. And it's already,
And ChatGPT is not even, I mean, like, if you look at like the new Grok that just came out, Grok 3 is It's a little, it's actually
scary.
scary. And you know, DeepSeek.
Yep.
You do the DeepSeek stuff. By the way, be careful with DeepSeek and your cell phones. I don't want people to say that Sinicropi guy said use DeepSeek and now something. That's
use
fine.
a burn phone.
That's fine. Use your burner phone. Yeah. I mean, I use it, and I'm not afraid. But I'm just saying it's interesting because the difference with DeepSeek is it shows you its thinking pattern.
Correct.
So it's like, well, I'm going to do this. Oh, the doctor asked me this. Oh, I'm going to put this together, and he really seems to want to be like do it in this way, and then it'll all put it together. So it's pretty fascinating. So listen, this has been a great discussion.
It's an honor and a privilege.
Love having you on. We got to do a longer one. We have to do my normal 3-hour format because you know there's so many things. We could go into spine, like treating spine infections and complex care and whatever.
Yeah.
But you know that takes. If we start geeking out on spine surgery, you know that'll consume
we'll be here
stuff.
Until the end of the conference.
And most of the people won't have a clue what we're talking about if we start. But we can do it in our own way.
Sure.
So usually we'll do the fun stuff up front, and then I get into the details because by then people can decide if they want to stay on or not. So anyway, it's been great, Dr. Marc Moisi.
Pleasure.
Fantastic.
Thanks for having me.
We'll see you next time.